Hello, my name is Gabriela Cueva, and I am going to talk about the multiple endocrine neoplasia men syndromes are characterized by tumors of neuroendocrine origin. The theory of this MEN3 syndrome, also called MEN2B syndrome or multiple mucosal neuroma syndrome, was initially described by Weisman in 1922. It's associated with adrenal varix chromocytoma, medullary thyroid carcinoma, diffuse alimentary tract ganglioneuromatosis, and multiple small submucosal neuroma nodules of the upper digestive tract. The disease is inherited as an autosomal dominant trait, although many cases appear to be spontaneous mutations.
Characterized by tumors of the endocrine glands, usually more than one. Sometimes they're malignant, but usually they're not malignant. So we'll just go through each of these one by one, starting with MEN1. So MEN1 consists of pituitary tumors, parathyroid hyperplasia, and pancreatic tumors. Now, which one of these is involved with MEN2A? Only one is involved with MEN2A. Right, exactly. So parathyroid hyperplasia, and then there's also medullary thyroid carcinoma and pheochromocytoma. Now, only two of these are involved with MEN2B. Just two of these. And what are those? Right, so medullary thyroid carcinoma and pheochromocytoma. And then finally, there's the marfanoid body habitus and mucosal neuromas. And the mucosal neuromas are found in 95% of people with 2B, so they're very sensitive. Now, the way I remember these, the 1 from MEN1 can be stretched, and then along that axis, you'll find the pituitary, the parathyroids, and the pancreas. Now, I realize my 1 wasn't stretched wide enough, so I did not hit all the parathyroid glands, but I think you get the point. MEN2A, so the 2 from 2A reminds me that two of these involve the neck, so the medullary thyroid carcinoma and the parathyroid hyperplasia. And then the A from 2A reminds me of the adrenal glands, i.e. the pheochromocytoma. And then finally, MEN2B, to be a marfanoid-like man or woman. And that's it. So I hope this was of some use to someone, somehow, some way. And until next time, take care of yourselves.
Clinical features. Mucosal neuroma of this disease present as a 2-7 mm, yellowish white, sessile painless nodules of the lips, anterocto and buccal contours. Usually there are 2, 8 or more neuromas with deeper lesions having normal coloration. There may be enough neuromas in the body of the lips to produce enlargement and a blueberry lip appearance. Facial skin, especially around the nose or eyelids, may also be involved.
Alright, so MEN stands for multiple endocrine neoplasia. And basically MEN describes a few syndromes where, if we were to just speak plainly, there are many tumors in endocrine organs. And they can be benign or cancerous, and there are 3 subtypes, which we'll discuss in a little bit, and they're all inherited in an autosomal dominant pattern. Alright, so let's review the relevant organs of the endocrine system. And keep in mind that this list isn't comprehensive. We're just talking about the particular glands that are relevant to MEN. So the first gland that I just want to point out is the pituitary gland, which you'll find in your brain. And I'll bring up the little picture that I've drawn here. And highlighted in blue here is the pituitary gland, which just sits kind of in the frontal part of the brain. Next there is the thyroid gland, which you find in your neck, which you can see here just drawn in pink. These are the 2 lobes of the thyroid. Next up are the parathyroid glands, which are embedded within the thyroid gland. And the para in parathyroid actually means beside. So we'll show you what that looks like here. This is just kind of a zoomed up image of the thyroid, and then these 4 parathyroid glands are just embedded within the thyroid. Next up is the pancreas, which is in your abdomen. And here I've just drawn a little schematic of some of the organs that you'd find around the pancreas. And so here's the liver, here's the stomach, the gallbladder, and then the pancreas kind of sits in between the stomach and the beginnings of the small intestine. And then finally, I just want to point out the adrenal glands. And the adrenal glands are just two glands that sit on top of each kidney. And so here I've drawn the kidneys in red, and then the adrenal glands are in the pale yellowish color sitting on top of the kidneys. And so each of these glands are responsible for secreting various types of hormones, and thus they're considered to be part of the endocrine system. So now let's talk about the first subtype of MEN, and that would be MEN1. So the MEN1 gene is actually a tumor suppressor gene that codes for a protein called menin. Now, people with MEN1 usually inherit a defective copy of the gene at birth, and then a second mutation in the remaining allele results in a loss of function of the MEN1 gene in these cells. And this allows them to divide with little control and thus form tumors. And so these patients tend to form tumors in three characteristic areas. The first being in the pituitary gland, the second being in the parathyroid gland, and the third area being in the pancreas, which can manifest in the form of Zollinger-Ellison syndrome, insulinomas, VIPomas, and rarely glucagonomas. And sort of a key association to know with MEN1 is, and this will often show up in question stems as sort of a hint as to what you should be thinking about, is that these patients will also have kidney stones, which is due to the parathyroid tumors that alter calcium and phosphate levels, and then they will often also have ulcers, which are due to the pancreatic lesions that lead to, say, Zollinger-Ellison syndrome, which stimulates the acid-secreting cells in the stomach. So that's the basic overview for MEN1. Now let's move on to MEN2. So MEN2 is caused by a mutation in a proto-oncogene as opposed to a tumor suppressor called RET. And this codes for a receptor tyrosine kinase that plays a role in signal transduction. So unlike MEN1, which is a loss of function mutation, MEN2 is an example of a gain of function mutation, which results in a constitutive or continual activation of a gene and leads to uncontrolled cell division. And let's give ourselves a little bit more room here since we're running out at the bottom. Alright, so there are actually two subtypes of MEN2. There's MEN2A and MEN2B. So the three types of tumors that are characteristic of MEN2A are medullary thyroid carcinoma, pheochromocytomas, which are tumors of the adrenal gland, and parathyroid tumors. And then the three types of tumors that are characteristic of MEN2B are also medullary thyroid carcinoma, which I'll just abbreviate here, medullary thyroid carcinoma, as MTC, and pheochromocytomas, which I'll just abbreviate here. But instead of parathyroid tumors, these patients tend to form oral or intestinal neurofibromas, which are benign nerve cell tumors. And then MEN2B also has sort of a key association, the way MEN1 is associated with kidney stones and ulcers. But in MEN2B, these patients will be described as having a marfanoid habitus, which is just a constellation of symptoms that resemble those of Marfan syndrome, including, say, long limbs, arachnodactyly, and hyperlaxity of joints. And so there's your overview for MEN syndromes. You have MEN1, which is associated with pituitary, parathyroid, and pancreatic tumors, and then MEN2A and 2B, which are associated with medullary thyroid carcinomas and pheochromocytomas, and then MEN2A with parathyroid tumors, and then MEN2B with neurofibromas. All right.
Applications in medicine. The neuroma is comprised of a partially encapsulated aggregation of proliferation of nerves, often with thickened perineurium, intertwined with one another in a plexiform pattern. This tortuous pattern of nerves is seen within a background of the loose endoneurium like fibrous stroma. Individual nerves flow in fascicles of 2-3 fibers and are histologically normal except for occasional hyperplasias and bulbous expansions.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from
First Aid for the USMLE Step 1, 2013 edition.
Page 570, Rapid Review. What is multiple endocrine neoplasia 2A, also known as MEN 2A? Multiple endocrine neoplasia 2A, or MEN 2A, is an autosomal dominant condition which can lead to benign or malignant tumor formation of the endocrine system. And the reason this happens is due to the mutation of RET gene. What are the classic clinical presentations seen with multiple endocrine neoplasia 2A? The classic clinical presentation of multiple endocrine neoplasia 2A is thyroid and parathyroid tumors along with pheochromocytoma. What is multiple endocrine neoplasia 2B? Multiple endocrine neoplasia 2B, just like multiple endocrine neoplasia 2A, is an autosomal dominant condition with RET gene mutation. What is the classic clinical presentation seen with multiple endocrine neoplasia 2B? The classic clinical presentation of multiple endocrine neoplasia 2B is thyroid tumors, pheochromocytoma, and ganglioneuromatosis. What is ganglioneuromatosis? Ganglioneuromatosis is when you have widespread ganglioneuromas, and ganglioneuroma is a tumor of the sympathetic nerve fibers arising from the neural crest cells.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high-quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.
Treatment and prognosis. The mucosal neuromas of this syndrome are asymptomatic and self-limiting and present no problem requiring treatment. They may, however, be surgically removed for aesthetic purposes or if they are being constantly traumatized. The patient should be followed by an internist, endocrinologist, or other appropriate clinician relative to his or her potential adrenal or thyroid cancer. Because of the serious nature of the latter condition, it is strongly suggested that another family member be evaluated for MEN 2B. Pros, cons. It is a benign tumor of nerve tissues on the thumb, lips, and throughout the gastrointestinal tract. Genetic testing is highly accurate and is done to confirm the disorder. Relatives who don't carry the genetic mutations are not at a risk for developing the disease and do not need to be subject to further testing. Cons. The gastrointestinal symptoms of MEN 2B may occur early in life. Patients experience either chronic constipations or diarrhea, feedings, difficulties, dysphagia, vomiting, borborygmus, and intermittent abdominal pain may also be present. Muscle, joint, and spinal problems. 95 affected. The risk of medullary thyroid cancer in people with MEN 2B is nearly 7% for all subtypes. Issue applied in Ecuador. In our environment, thyroid cancer is a common condition in women being located in fifth place, 8.5%, compared with men having a lower frequency being located in 15th place, 1.5%. It's found a low incidence pathology in our environment globally comparable, so its diagnosis and detection is extremely limited in developing countries because of limited complementary exams and hormonal and genetic level in our city. Issue applied in Ecuador. In the period 2007-2009, 129 patients were compressed in the Jose Carrasco Arteaga Hospital, and it was found that 121 were females, 88 were males, and found that the most frequent age range was 51–60 years old, a minimum of 2 years and a maximum of 87 years. It should be noted that the management of medullary carcinoma is subjective because it has not a good response to adjuvant therapy with either chemotherapy or radiation therapy.
Also of note is that it's autosomal dominant. Okay, so if you see someone with multiple endocrine neoplasia in one generation, you're probably going to see the next generation as well. So let's talk about the specific types. So the first thing we're going to talk about is MEN 1. Okay, multiple endocrine neoplasia 1. And this deals with the 3 Ps. Pituitary, parathyroid, and pancreas. So you're getting neoplasias in these 3 different areas. Okay, so people like to remember this by a diamond. Okay, so MEN 1 is a diamond. So you get your pituitary up here, your 2 parathyroids down here, and then your pancreas all the way at the bottom. So it's kind of a diamond, and it deals with 3 different things. 1 up here, 2 down here, and 1 down here. Okay, and what test takers like to do is come up with someone who has 2 out of these 3 neoplasias. Obviously, they're not going to say pituitary, adenoma, parathyroid cancer, or pancreas tumor. They're going to say someone coming in with hypercalcemia and they went in for neck surgery due to parathyroid tumor, or someone who has a bunch of gastric ulcers because of Zollinger-Ellison syndrome or gastronoma or something like that, and then you have to find out what the third one is. Okay, so basically it's the pituitary, parathyroid, and pancreas. Okay, and the pancreatic tumors that are more likely to be seen than not are the gastrinomas, the insulinomas, and the VIPomas. What's really rare are the glucagonomas, but they could also present as well. And you could also see stomach ulcers because of the gastrinomas, as well as kidney stones because you have a parathyroid tumor secreting a lot of PTH. And another name for MEN 1 is Wermer's syndrome. Wermer's syndrome. Okay. The next one is MEN 2A. Okay, again, this is associated with the RET gene. Okay, so you only have 2 things here. You have the parathyroids and the pheochromocytoma. Okay, so basically you have a square. So you know MEN 1 was like a diamond. This one's like a square because you have 2 of each. Because you have the parathyroids on top and the pheochromocytomas on the bottom. Okay, and they're both on symmetrical sides. Okay. And another name for this is Sippel's syndrome. So Sippel. Okay. So basically just think about a square, and you have 2 on top and 2 at the bottom. And another thing it's associated with it, but doesn't have to deal with the square, is you might get a medullary thyroid carcinoma, which secretes calcitonin. So you might have hypocalcemia. Okay, and that could be another clue as to what the other signs could be. And if you get hypocalcemia and figure something going on with the parathyroids, maybe you should check for pheo. Or if you have parathyroids and pheochromocytoma, maybe you should check for the medullary thyroid carcinoma. And again, it's associated with RET and it's autosomal dominant. And the last one, which is MEN 2B, it's just one thing you have to worry about. It's pheochromocytoma. But you have 2 other things that may not deal with the thing I'm about to tell you. You also have medullary thyroid carcinoma. So in the MEN 2s, you have medullary thyroid carcinoma, and you can also get oral ganglioneuromatosis. Okay, and the way to think about this is a triangle. So you have the oral up here and the pheos down here. But you can also get medullary thyroid carcinoma. Okay, and again, it's associated with the RET gene. So let's have a little bit of a review. So in MEN 1, you get 3 Ps, so parathyroid, pituitary, and pancreas, and you draw a little bit of a diamond. So you have the pituitary up there, you have the parathyroids here, and the pancreas at the bottom. In MEN 2A, you get 2 Ps, and think about a square. So you get the parathyroids up here, and the pheos at the bottom, as well as medullary thyroid carcinoma. And the MEN 2B syndrome, you only have one P, okay? So, and that's your pheo. So think about a triangle. So you have your neurogangliomatosis at the top, and then your pheos at the bottom. And you can also get medullary thyroid carcinoma. So try to associate that with the RET gene. You know how the RET gene deals with MEN2A and MEN2B? So think about the RET gene causing medullary thyroid carcinoma. Okay? Some other things that they might talk about is that MEN1 is also Wermer syndrome, and MEN2A is Sippel's syndrome. Okay?
Hi, I'm Lisa, and I have MEN. There are different types with different numbers, and I've got the second kind, MEN2. Here's what I know. Inside everyone's body are lots of things called glands. These glands make hormones, the chemical messengers that travel through our blood. Your glands make sure just the right messages get through to tell your cells what to do. This is the thyroid gland, which makes a hormone called thyroxine. This controls your body's metabolism and how much energy you have. They have to work hard to make sure our bones, muscles and nerves are developing in the right way. So they're always making new cells. But sometimes these new cells gang up into lumps. With MEN2, some lumps don't do anything. But some turn bad and start all kinds of trouble. What they do depends on where they start. If you have MEN2A, they try and stop your thyroid gland doing its job properly. In MEN2B, they can cause trouble in your mouth and in your tummy too. By messing up the messages, they can make you feel really weird in loads of different ways, like tired or sweaty. Doctors can test your hormones to see if you have too much or not enough, or take special pictures called scans to look inside your body. The best way to stop the problems is with an operation, sometimes before there's any bad stuff, just in case. It might seem a bit scary at first, but the doctors are experts. They can help get everything back to normal with medicine. I inherited MEN2 from my dad, just like my curly hair. Even though I will always have MEN2, there are loads of people keeping an eye on me to make sure I stay healthy. I can still do everything I love. And if I ever feel worried, I know I will feel happier if I just talk to someone. MEN1 and MEN2 are two different conditions, but you can learn about MEN1 by watching Daniel's film.